Hi, I'm Ray. I'm working with nurses here at Vernon Jubilee Hospital on interactive handover, or how to hand over where the receiver is very active in the conversation. We use a simple mnemonic called IDRAW. Identity, diagnosis, what are the recent changes, what are the anticipated changes, and what should I be worried about? Those two last bits, the anticipated changes and what should I be worried about, are crucial in patient safety, and it's incidentally how experts communicate. They ask very, very good questions.
And I'm a critical care nurse. I work in the emergency department and intensive care. Have been doing that for 18 years now. I'm
recently hired as a med-surg float. Beforehand I was working medical casual for a few weeks. I'm a new grad. I just got out of school.
I work on surgical unit.
The one that I see the most is that when I'm giving report to a ward from a critical area, I'm not always giving report to the nurse that's going to receive the patient. So I may give it to RN number 1, and she's going to pass the information over to RN number 2. So there is the possibility of information being lost there.
I notice a large disparity between myself and very experienced nurses, especially in acute regions and the highly acute regions such as the ER when it comes to report. Sometimes there's just different priorities. If I'm working on the medical floor and they're from ER, they have a very focused assessment, and sometimes I don't get necessarily all the information that I need at report. It tends to be very disjointed. It's hard to think linearly when you're getting random bits of information from different areas regarding the patient. So it's very difficult to get people on the same level, especially if you're the handover nurse, you're the one passing off the patient. You can have tons of things going on, and you haven't taken any time whatsoever to prepare yourself and prepare this patient for transfer. So a lot of times you get gaps and large gaps. Recently I had a patient transferred to my care, and the only thing I got from the transferring nurse was the diagnosis, and I was left empty-handed afterwards and digging through the chart.
So I've been using IDRAW since its inception. IDRAW is identifying the patient, giving their diagnosis or what's going on with them.
R for recent changes, A anticipated changes.
W stand for what to look for, covering all those bases. It's very helpful for the smooth transition.
How I use IDRAW is I typically have my little card here, and I like to refer to it before I give nurse-to-nurse handover at the end of shift.
For me, you're actually writing the information down. So when you're handing over via the phone, the information's right in front of you. You can read it, you don't miss things. It also prompts you to look through the chart to find things that you might otherwise forget to hand over in a verbal transmission of that information. And also I use the IDRAW. I put it on the chart and send it with the patient so that if for some reason it's not going to the same nurse, they can actually just look down and say, oh okay, there's the information.
So this is the exact place I'd be using the IDRAW tool. I just pick up the phone and it's gonna help me have a conversation with that person, a little bit of an exchange back and forth to make sure that we touch on all the points that are pertinent to both of us.
We have it readily available. We have the report sheets, whereas blank paper versus this IDRAW tool. It helps where you have all your questions, and chances of you won't miss any important information because it covers the diagnosis, identity, recent changes, anticipated changes, and what to watch for. And it saves nursing time, it helps with the patient safety, and I would continue using it.
If I'm receiving a report from a different ward, I'm going to grab one of the IDRAW tools from beside the phone. It has all the information on it that I'm going to need. I can just look down the list and find all the pertinent points. I can draw that information out from the person I'm receiving a report from if need be. So it's excellent in that way.
So we've used these cards that you'll see right here. This is IDRAW on one side and SBAR on the other. SBAR is a great tool for urgent communication and clear, concise communication in urgent circumstances. If I'm calling a physician in the middle of the night for something urgent, SBAR is a great tool to use. What's the situation, background, assessment, recommendation? But for most handovers, IDRAW works very nicely. And so we have a tool that you can put on your lanyard. We actually zip tied these things to the telephone cord, to the proximal end of the telephone cord, so that they're always available. So if you don't happen to be wearing this little mnemonic, it's available for you. And when you pick up the telephone cord, it's right there.
So this is the SBAR tool that we use for the communication for the urgent patient needs and when we're calling the doctor in the middle of the night. This is the IDRAW we use daily for handover reports so we don't miss any crucial information. It's pretty handy.
Hi, I'm Tina Coletti. I'm the manager of the Vernon Jubilee Hospital Emergency Department. Some of the problems with standardizing handover have been that nurses have been absolute rock stars at being able to do handover in their old formats. By being able to do it standardized, it's been a big change management issue. People have had a really difficult time starting to learn how to do it with the new format. So the leadership has been able to take a really strong approach. We've worked together as a whole leadership team in our organization, from our leadership, senior leadership down to our unit managers. We've also been able to create tools so that all the departments have tools to be able to use. We've had a real shared vision of what patient safety is about. We did surveys ahead of time, so we were able to use some of that messaging to the nurses. About 70% of all errors are because of communication errors. Keys to success for other organizations taking on the IDRAW project are really create your unit champions. So the unit champions are essential to have success within your program. They're the people that are going to be looked upon through all of the different areas within the department of understanding this process, so you need to create that shared vision. Often it can be seen that there was something wrong in the system that was done before, and it simply needs to be messaged that we're trying to improve upon and increase our patient safety in handover systems. So if we create that shared vision, everybody understands why we're trying to do this. We create and support them with all the tools that they need and really listen to their feedback. This is a big change in the processes that nurses have been able to do previously. Other units had all sorts of different handover tools that they used. So now we're asking them to use one different handover tool that they had not used. So understand they used to be a rock star. Now they're not feeling so easy about it anymore, and it's just those baby step growing pains that they're going to do, and just to really support them. IDRAW, it's a flexible tool that can be used at any time for any handover. It's so that the sender and the receiver have a conversation so that we can ensure there's better patient safety, better patient communication.